Now, there is no denying there is a lingering hangover from the pandemic among many people in this province, and not just from those angry about restrictions. The healthcare system spent years under siege, and that's made the future of healthcare the #1 ballot issue heading into voting day.
Danielle Smith wants to dismantle public health care and force you to pay to see a doctor.
In a province where politics was once about pipelines,
and I believe no one should ever have to pay out of pocket to see a family doctor.
healthcare now reigns supreme. And post-pandemic, things are a mess.
3 years I've been on a list.
We're even getting to a point now where emergency rooms are closing.
We have one obstetrician and gynecologist in Lethbridge.
It was getting to the point where it was dangerous for me to drive.
Problems with healthcare aren't Alberta's alone, but within the province, the COVID years saw plenty of acrimony between healthcare workers and the Jason Kenney UCP. That conflict has had consequences.
Data from the Canadian Institute for Health Information, CIHI, shows that we lost more family physicians to net migration out than any other province in 2022.
Alberta's next government will need to bring those doctors back while working to address a backlog of deferred care.
The pain was excruciating.
Calgary stage actress Catherine Kurbis had been waiting for a hip replacement for nearly 2 years when a surgeon told her she'd have to wait at least 1 year more.
My husband immediately started looking at private surgeries because he knew how much pain I was in all the time.
So in March, Kurbis paid out of pocket to have her surgery in Toronto. According to the Canadian Institute of Health Information, Albertans had some of the longest waits for hip and knee surgery in 2022. In January, the United Conservative Party unveiled a plan to contract thousands of orthopedic procedures each year to a private surgical facility. Though CIHI says the impact of this move is not yet known.
A lot of the contracts have just most recently been signed, so it will be interesting to see its impact on both the waits and the numbers of people waiting for surgery.
The Alberta NDP, meanwhile, says it will address surgical wait times by expanding access solely within the public system. Two parties,
Our UCP team is improving healthcare for
with two different plans.
Our Alberta NDP will fix healthcare.
Question for voters, who to believe. Heather, Yourex-West, Global News, Calgary.